Hey, hey, hey. Good day, good day, good day. This is Dr. Karen Aneita Gaynair. I'm a medical doctor, MD. I'm a primary care physician, but I'm also a specialist who specializes in family medicine. And for those people who don't know what family medicine is, you have your general practitioner, and after you get general practitioner or become a medical doctor or a doctor of osteopathy, you can specialize in family medicine. Family medicine is a residency that you go through for like 3 years to specialize, and you can even do more training after that to become a fellow. So basically, we have a lot of experience with treating patients from the womb to the tomb, from babies all the way up to the elderly. And we also do hospice care, palliative medicine, all types of things. And one of the ways I keep up to date is I get a journal from American Family Physician. Basically, this is a journal that I get every 2 weeks from them, and I get updates. And one of the things that they updated me about in December was about the influenza virus and how to treat and diagnose it. So basically today I was just going to make just a quick lecture, guys. Hi guys on Instagram, hi on Facebook, big up, big up. As I'm going along, if you guys have any questions, just comment and just ask me anything you want, anything. And feel free to say anything that you want to say. So what's been going on is that there's a lot of things that's been happening out there. There's a lot of tests that's been developed. Better testing has been developed out there, guys, that give us quicker results and give us more information. So as we're going through the coronavirus pandemic right now, and today is April. We're in April 2010 right now. And right now, what's going on is the government has been setting up a lot of testing sites around Florida and all over the US. In Jamaica, I'm from Jamaica, but I live in Florida. And Jamaica have been having a problem with getting their tests. And I think that is something we need to talk about differently too. So anyway, so they're not getting the chance to do as much testing as possible because they're getting some fight, political reasons. They're getting a fight to get their tests. So anyway, guys, so the good thing is, I wanted to talk a bit about immunity and so, because lots of people don't like vaccines. There's a lot going on the internet where the people are spreading false information. People are scared and think that this has been man-made purposely to kill off people. People think that people make vaccines to kill people off as well. So, for example, there are pictures of Bill Gates administering vaccines in Africa or wherever he was. I don't know where he was, but he was seemed like he was helping to give an oral vaccine, which we commonly do for like the polio. The polio vaccine is a drop that you put under the mouth, under the tongue, and that is how we administer it to kids and adults too. So anyway, so cut a long story short, vaccines have been around for ages, guys, and we have a schedule of vaccines for kids and for adults. So that way, when you're born, you get certain vaccines, and as you get older, you get vaccines to prevent you from getting sick. So if you take anything away from this talk, just remember that vaccines are made up of antibodies. So that way they can help you to fight, made up of antigen or the virus itself or bacteria. And what they do is create an immunological response when you get a vaccine. So no matter what vaccine it is, guys, remember that vaccines are put into your body pretending as if you're getting the virus. Like we purposely want to give you the virus so that you can build up antibodies. So it might sound a little backward and so, but what we want to do is build up your immunity against a particular thing, a specific thing. So what they're doing right now is trying to find a vaccine to go against the specific strain of the COVID-19. Because coronavirus has been around for a long time. It's nothing new. It's older virus. Even when you look at the Lysol container, you see coronavirus on there as something that it is effective against. So when it comes to vaccines, guys, it's a very important topic. A lot of people are dying because they do not get vaccines. A lot of people in developing countries, they're drinking water, getting things, bitten by a mosquito. But the thing is that there's a lot of viruses and bacteria out there that they've developed vaccines against. So I could show you a schedule of all of them. We're not going to go into detail about that. What I wanted to talk to you about, guys, is just the principle of vaccines and how we want to build immunity. So building immunity, you can do it through diet and nutrition. But what we want is the actual antibodies. So antibodies are in your body, guys, naturally. And they're made against something specifically. So if we catch a common cold, if we're exposed to a bacteria or certain germs, your body already makes antibodies against it. So what they're doing right now, guys, while we're waiting for them to develop a vaccine, we have to find some way to help patients. We don't have any medicines to treat anyone for the coronavirus. There's a lot of speculation about anti-malarial drugs like the hydroquinone and quinine and so forth that we use for malaria or against malaria prophylactically or to treat malaria. That is something that we don't want you guys to take. All right, so as medical professionals, we have not gotten the data on this. Okay, so do not take anything unless you know about the facts, and make sure that it's been tested the right way. Make sure that it was tested among a big population of people and that it came out safe. You know, later, sometimes we find out later on things are not safe. So it's basically something that you can wait and see what happens, and you don't have to jump and get it, you know, when it comes out. So don't be scared about it. So, but while we're developing a vaccine, we have to try to figure out a way to help patients. While we're trying to figure out a cure or figure out medications to help treat symptoms or to treat the virus specifically, we still have to find a way to help patients. So apart from just managing the symptoms, guys, with cold medicines, fever medicines, medicines that help you coughing, your sneezing, the shortness of breath, you know, using the ventilator and so forth. Those are basic medical stuff that we do to help everybody to resuscitate, you know. One thing that has come out recently, guys, I thought that was pretty cool and thing is that they are accepting plasma donations, which is pretty cool. Now, I'm somebody who donate blood, and I'm somebody who had to get blood after I had my spinal cord surgery. I got dizzy, short of breath after walking a small way around the nurse's station. My blood pressure, my heart rate went up, and there were signs of low volume. And I asked them to check my hemoglobin, and it was low, and I got a unit of blood. I came out fine. I've not had any infections. I've been tested many times since then. Just like my vaccines that I've gotten from as little, I've gotten vaccines from as born, and I've gotten vaccines for school that I needed to go and do my clinicals as a doctor. I've had to get my boosters as well, even when I was in practice. I made sure to make sure my husband got his, my family got theirs, because as adults, we also need to get our boosters, especially against pneumonia, like Pneumovax. The Tdap is new against tetanus, diphtheria, and pertussis, which is whooping cough, diphtheria, and tetany. So the thing is, like Anthony, like Tony works in construction, he can get stuck by a nail anytime or get cut by a zinc, and all these things can happen, and he can get tetany quite easy. So the point is, the reason for you guys to go and to get a physical is not because you're doing bad or you're feeling unwell, but even when you're totally well, even when nothing you think happening to you is going on, you go to the doctor, especially family medicine or internal medicine or pediatrician, people who know about vaccines, people who know about preventative care. That's what we specialize in. So we look at your age and we look at the schedule. We see what you have gotten. And even if you never got anything, we have a guide, and it's a guide. Remember, we doctors are not the ones who come up with these things. Remember, we learn as we go along. And medicine is a practice. So as we're going along throughout ages, guys, we've been discovering things and making it better, making it more efficient. You know, just like the coronavirus testing, they've actually improved on it already. So the scientists out there are awesome. So big respect to all the scientists out there. Big respect to all the people who contribute to research and try to get us cures, try to get us treatments, and try to make us find out more about these things. Because I'm not into research, I'm into practicing medicine, you know. So cut a long story short, that's the reason why you go to the doctors of certain types, you know. And it's not every doctor want to keep vaccines. It's not every doctor know about vaccines and keep them in their place. You have to know how to store them properly. First of all, you got to buy vaccines, and you have to, and if you're going to give people the vaccines, then they should be able to afford it. One thing about America that I love is that they have a vaccine for children's program where they give vaccines to me, a primary care doctor, for free. They give me free vaccines, and they keep a tab on them, and I basically have to keep them in a separate fridge from my private vaccines, and they're called VFC vaccines or VFC shots. So I call it Vaccine for Children, VFC. and we have it in their own fridge. We monitor the temperature as we come in the morning and as we leave in the evening. You have to watch the temperature twice a day and record it in the freezer and the fridge. And I've had to train my staff how to help me to do that, to monitor them. I've had to account for the vaccines, and if we don't account for who we gave the vaccines to and they don't add up, then I have to pay that bill. So nothing is free. Somebody paid for that program to exist. Somebody paid for those vaccines to be made. Because remember, they have to be made somewhere. Somebody have to be paid to make them, to distribute them, and to even give the shots to people. So basically, I don't have a doctor's office right now because I can't afford to pay people to open up my office and to practice. I can't afford to pay another doctor to work for me. Everything costs money, and somebody has to pay it back. So this basically, they have a grant or however they get the benefits, and so the government has benefits and the states have their own benefits. So the state of Florida have the program, and they send people out to our office to even audit us and to check up on us and make sure that these vaccines are stored well and that we're actually doing the right thing. So if you can't keep up with that, it doesn't make sense to even give vaccines, because we're supposed to handle the private vaccines the same way. So I've learned a lot from participating in the Vaccine for Children's program in Florida, and I've given a lot of patients vaccines for free who couldn't afford it, black and white, Chinese, Indian, African, all types of races that you can imagine, because kids need vaccines to go to school. They need it for sports, for their sports physical sometimes, especially the tetanus and the MMR. When they're going to college, they need to fill out forms as well to get them into college, especially if you're going to live in the dorm. You need meningitis vaccine, the meningococcal, and the pneumovax is also offered too. So the point is that for different people, different ages, and your circumstance, you need vaccines. So everybody is different. Everybody has their individual need. Everybody has their own reaction to things and may have allergies. So, for example, we don't give people the flu shot if you're allergic to eggs, because the flu shot was actually made and harvested in eggs. So if you're allergic to eggs, you might get sick from the flu shot. If you're allergic to certain preservatives, you can get sick from them. So they make even vaccines without preservatives, so that way we can lower the reaction, the side effects. So they try their best, guys, to keep down the side effects and to keep the benefits going, so that way we don't get sick. And trust me, if they see that a population or a certain amount of people getting sick or have certain side effects, they're going to stop it. That's our job as doctors and nurses and so forth too. We have to report we have to report side effects or mishaps, so that way they can know about it. And it's with any medicine or chemical that we use or prescribe. If we see that there's something that's wrong and we see a trend or a pattern, we're supposed to report it to even like the DEA and so forth, So we have our part as doctors and so on. It depends on how you're trained, Some people don't even know about that. Some people don't even know they need to report it, but it's a part of our license, to do no harm. So as long as all of us participate in doing no harm, then we're on the right page. So Bill Gates is somebody who's been donating to, he has his foundation. He's been donating to development of medicines and interested in science. He's an investor. He's a businessman, but he's also somebody who researches a lot and reads a lot and researches. So I respect people like him who donate towards research, even if they have an ulterior motive to benefit from it or, but they're all about helping people is my assumption. So there are a lot of posts going on about Bill Gates being in Jamaica and how people shouldn't take the vaccine. First of all, there isn't a vaccine. He's not in Jamaica, and even if he wants to go to Jamaica, power to Bill Gates, is the government who has to allow him to get in and so forth. Sometimes people have their agreements, sometimes people donating or bringing things to help the people, and the government can allow them. But a lot of these posts that are going on out there are old, from like 2016, 2018. They're old things that people have been posting. Another thing I want you guys to be careful about is President Trump has been talking a lot about not only the hydrochloroquine and the Z-Pack and quinine and all these things, but he has just come out with, how I'm wondering if people can inject themselves with bleach or disinfectant. And even though it might seem funny, some people might actually do it. So that's why I do these talks and say, what, you guys please don't take the bleach. Please don't ingest the bleach or inject the bleach or so, because you can die from it, all right? You can pass away from that. And this is President Trump doing that, So basically, he has advisors and he has people who is advising him, but I don't know where he's getting these things from. So, cut a long story short, what I wanted to talk about is how, you know, like I said earlier, people usually donate blood, and when you donate blood, or you could even donate plasma alone. So blood is made up of different parts. You have whole blood and you have plasma. So when they spin the blood, when you spin the blood, the heavier things fall to the bottom and the light stuff go to the top. So the top part of the blood is called plasma. So anyway, within that plasma are the white cells, are all those cells that we need to defend us and fight for us. That's where the antibodies are. All right. So basically what they want to do, guys, is spread the news so that people who already got coronavirus and have recovered from the coronavirus, they want you guys to please donate plasma. There's a physician who died at the University of Miami, and so on. His family, I think they were positive too, but he was positive and he ended up passing away, and his family ended up donating plasma already so that they can help other victims who are suffering on the ventilator, like people who are really, really, really sick, not with mild symptoms, but people who are really, really sick right now. The University of Miami have been doing their research, and they've been transfusing plasma. So plasma is a thing that they're injecting, not bleach or Lysol or disinfectant. Okay, guys. So seriously, guys, if you guys know of anybody who's been positive and they're doing well in terms of their recovered and so, please go to a blood draw station in your state or your community. You know, check on the website. Check Red Cross blood. You know, redcross.org. Check One Blood is a company that I usually donate through here in South Florida. They sometimes have their vans going around from I've been in college and so forth. I've been donating from like 1996 when I was in college, because the van came to our school to try to get blood. So blood is a medicine. Blood is a medicine, guys. And blood is something that you don't just give to any and anybody. They try to test the blood as best as they can to make sure people don't have things like, you know, you can't test for mad cow disease, but they screen you very, very well about your travel history, where have you been, just like we've been doing for anything else in medicine. We screen you and ask you the questions so we can see if you're somebody who is a good candidate to donate, because we can't test for everything, like I say. Anyway, so what I was wanting to talk just about the antibody part of things. And just remember, guys, vaccines basically are introduced into your body so you make antibodies. Okay, so your own body make antibodies so that if you're exposed to whatever the illness is, whether it's the flu, the coronavirus, whatever it is that you got the vaccine for, you won't get as sick. Doesn't mean you're not gonna get sick. Remember that the vaccines are not 100% protective. Okay, like when we got the BCG vaccine in school in Jamaica against tuberculosis, that's 70% protective. So even though they injected all these kids and lined us up and so forth, they basically, it wasn't 100%, but it still helped us to get protected from the tuberculosis, so we don't get sick and lose our lungs and get those problems from the TB. So basically, that is one thing, one vaccine that was popular in Jamaica as I was a kid, is the BCG. All right, but in England they don't give it, and a lot of countries they don't give it, and they don't line us up. So basically each country has their own way of doing things. Some people line up kids, line up people, and they just inject because it is an epidemic, there is an outbreak, and there is a need in that community for whatever the vaccine is. So when you guys see pictures of like Bill Gates putting things on the people's mouth, in their mouth or tongue, it's an oral vaccine that they're giving the kids, and more it's probably the polio, because the polio is an oral one. The flu one even has a vaccine, has one where you just squirt it in their nose. The influenza vaccine, the flu mist is what it's called, and you just squirt it up and you make them sniff it in, and that is another way to give the vaccine. So we don't always give vaccines by injecting. We don't always give vaccines through that route. You know, we have many routes. We have you have sub-Q, intramuscular, intranasal, oral way. All right, so we train our staff, we train people to give the right thing and to look out for that on the bottle and stuff, so we make sure that we put it in the right syringe and everything. All right, so that is one thing I wanted to clarify, is that probably he was helping people and helping good G, so he who took the polio drops. We all did. It's a part of schooling. It's a part of the shots we need for school. So that's what you get when you go to the clinic, to the health department, or you come to the pediatrician or the family medicine doc. that is what we do when we combine all these medicines for the babies. So for example, a 2-month-old might come into my office and we might give them like 8 shots because they need the IPV, they need like about 8 different antigens in their body to protect them. So we do a lot for the little babies as they're getting older, so we build up their immunity. So anyway, so at least you guys understand about antibodies. So remember, antibodies fight for us. Antibodies fight against things. So that's what we find in the plasma, and that's what we're going to find naturally in our body in the plasma, like I said. So anyway, so they're using antibody treatment right now at UM. So big respect to them at University of Miami. I was a patient there for my back, my spinal cord surgery. And they get busy down there, you know. But they have very different departments, a couple different departments that do things. And the infectious diseases department has been working with them and researching all of this. So one other thing that I wanted to mention is that, so basically vaccines provide immunity. So vaccines can help build up your immunity, and just being exposed can build up your immunity. So with that, guys, with you just knowing that background, I want to go into the tests that we have right now. That basically they came out with different tests for the coronavirus, for the COVID-19, okay? So we call these tests point of care testing, POC. Either way, point of care tests are tests that are easy to do, meaning somebody can just pop into your office and you can get the sample done, and then you can send it off to the lab, or you get the result right away. But a point of care test usually gives you some results right like within 15 minutes, 3 minutes, 5 minutes. So pregnancy tests, for example, are out there and can give you results in 3 minutes. There's the influenza test that's out there that can give you results in 15 minutes. The strep test, rapid strep test, let's call that 15 minutes too. So basically each thing comes with a swab, or they come with different ways to collect the sample. So what we got to do when these tests come out, guys, no matter what test it is for the coronavirus, we have to train people how to give the test. So right now they have a swab that they're using. They have a long swab that they're using to put all the way up into the nose to get all the way down here into the pharynx. So it's not a nasal swab, it's an oropharyngeal swab, or nasopharyngeal swab. So that's why it hurts, because it has to go all the way down up into the nose and go and turn that corner and go back into the pharynx. Okay, it might not turn, as long as we can get it right straight ahead, we can get it. All right. So basically we have to train the nurses or staff or assistants who are helping us, or lab techs, whoever it is that's doing it, to get the sample to get the cotton to the right place, the swab, so that we can get the right sample in the back of the throat. And then when you get that sample, you put it onto the test, and basically it gives you the results in whatever time, or you send it to the lab. So what happened is they're making tests that give us results quicker. But what I love about the tests that they have nowadays, guys, they have a control. They have what they call an IgM and an IgG. Now, there's one test that can tell you negative or positive, okay, guys? So there are tests out there that are done without going into the chemistry of things. Just know that they're tests like the pregnancy test, you know. They're either negative or positive. And as long as the control is showing up that it's a good test, then you know it's a good test. But what they've done is develop a test that shows us whether you have the infection right now. That is what some people confusing the tests with. So what I've been hearing about is somebody was already positive for coronavirus and they wanted to get retested. We know they're positive already. We know they already got the virus and they're positive. So the point is, what test do you do? So it seemed like the doctors didn't have the right test in their office to determine whether she still has an infection now or had one in the past. So they basically sent her out to another location to get tested. And people might not have understood that it's a different test, that they have different tests out there, you know what I mean? So what happened is the person didn't get retested in the physician's office. They had to go somewhere else, and then they were told that they were still active with the infection. So that way they can quarantine and they still can avoid work, make sure they're safe around their family, because they know that they have the infection right now, today. That is what the IgM tells us, okay? So IgM tells us what's going on at the moment, right now. All right, and once that's positive, they're still infected. Okay, once you already had the virus Some of these tests can become positive or and things like HIV. So you have to know how to do these tests and how to use, who to use them in. So it's similar to like the HIV test. We have a rapid HIV test. And once people are positive with HIV, they'll always have a positive HIV test, even if their viral load is way down. So what happens, we have to do viral load for them and to count the actual virus they have in their body to see if they have any virus, because their HIV test would always be positive. So I have a feeling that's what happened with the coronavirus test. The coronavirus test will still be positive, but it's not going to tell you whether it just whether you're infected now or you had the infection last week or the past. Let's just say in the past, okay? Don't tell you a timeline. All right. So that's basically the innovative thing they've done. They've done the antibody test as a rapid test where you can check for IgG, IgM. It doesn't give you a number, doesn't give you a titer, is what we call it. And a titer is basically showing you that you basically have this amount of antigen and this amount of antibody. You understand? So something like hepatitis, for example, we do a lot of antigen tests and a lot of antibody tests for hepatitis patients, Hep B and C, and even A. So like I said, guys, when you go into school, like going to clinicals for nursing, or if you're in the healthcare industry at all, and you need to get into college or school or even to work, you have to get these antibody tests before you even work in the hospital and things, because they don't want us going in there to make people sick. So that is why the vaccines are so important, like wearing the mask. Wearing the mask is important so that other people don't get sick. When other people wear the mask, they stop you from getting sick as well. So anyway, I know I went on a little tangent, but anyway, just understand, guys, that vaccines have a way of building your immunity by creating antibodies. Antibodies are our defense and the things that fight for us, okay? The antigen is what we need to get rid of. The antigens are what's in the vaccine. The antigens are in the vaccine so that they can build up an immune response and cause you to create antibodies within your body. All right? So there's a lot of speculation going on, or have been in the past, about vaccines like MMR, for example, the measles, mumps, rubella, that it causes autism and these things in kids. That's been proven wrong. You know, they've had lots of research done. There's a lot of articles out there, like how I read my articles, and they gather evidence-based medicine. You know, the data that you get and the source of the information is very important, because people put false information out there. People can skew data as well. People can change up numbers and change figures, or present data to you in a certain way that looks good and sounds good, and you might think that it is a beneficial thing when it really isn't. So basically, hopefully that helps you guys with the whole treatment and thing and the testing as to what's going on right now with coronavirus. So we need more testing out there. Somebody mentioned getting tested for free. Nothing is wrong with that. That is okay. But remember that somebody has to pay for it, like how I mentioned about those free vaccines that I used to give in office. Somebody had to pay for that, and that was the state of Florida. The state of Florida took care of that bill, and if I wasted it or didn't use it appropriately, I have to pay the bill. But when people could not pay $10 to get the shot, if I wanted to charge $10, $6, I was allowed by law to do that. And if people couldn't afford it, we still gave them the vaccine. If them can put a $10 towards it, like towards my syringe and my needle and thing, and my light bill, because I'm storing the vaccines, and so I appreciated that. The state allowed us to bill for administration of vaccine. So that's why I said nothing is free. It's not so much about the vaccine, but you got to pay people to give it. You have to pay people to help to give the vaccine, pay them, take care of the light bill, take care of the storage of these things. But you got to pay somebody to order the vaccines as well. So it's back down to square one. Everything takes money. Everything costs money. So I'm sorry for those people who don't have access to care and who are not able to pay for the test. But nothing is free out there. And it might sound cold, but it's just hard. You know, it's like a lot of people have it hard. And the more things we give free in our office and the more things we do for people, we can pay our staff as well, and we can pay our bills. You know, so we do whatever we can to help people, but we can only do but so much, you know. So right now, guys, just look out for each other and wait. You know, just be patient and wait, and let's see what the scientists come up with out there in terms of treatment and diagnosis and so forth. But right now, they have some tests out there, guys, and people are going for the tests. People are getting the antibody test, is what it's called. for the coronavirus vaccine. I've seen one of my colleagues, couple colleagues who work in a doctor's office, and their boss, the doctor, ordered the test for them, for their staff. They just wanted to make everybody get tested, and they're the ones who send their staff to get tested. So everybody has their own way of practicing, but that's what I used to do for my staff too. I never charged my staff for anything. I always made sure that they have all of their things up to date, and if they didn't want to see me as a doctor, because I preferred to that they keep their privacy and to keep their private information if they didn't want me to know about their private life and their health care, that they could go across the street, they could go anywhere, and I would help them as well with the bill if it's something I could afford, you know, if it's reasonable. But I always try to keep it private, and I always try to update my staff because it is a part of our job, you know. But it costs me, and vaccines cost a lot. The vaccines are not cheap, you know. They're a couple $100 for even some of them that I'd have to give, that I used to give to patients. And when I bill insurances and they pay me back, I only make like a $2, $5, $10 here and there, you know, and it adds up in the end. But we don't make big money off of vaccines. We're not into it for the money. I personally wasn't into it for the money, or not into it for the money. I just see the vaccines as something to help people and help stop the spread of illnesses, help stop the spread. The perfect examples of how vaccine have been helping us, guys, is back to polio. Polio is one of the most debilitating illnesses that has come onto the earth, and it caused people not to walk properly, affect their nerves, their muscles, and cause them to get really sick to the point where it caused them muscular paralysis in the chest walls and make people don't breathe properly anymore. So that's eventually how the polio patient passed away. So with polio vaccine that we've been given from birth to the kids and reaching out to people all over the world, you know, big respect to all the companies and so forth out there, and people who have been donating their time, money, energy into helping people to get the vaccines, you know. So big respect anyway, guys, for you guys out there. Remember to just look out for the news, look out for things, and if you need to get tested, you can go on you can go to the Department of Health website. You can go to the website or call the numbers that they have out there. But they have some phone numbers out there that if you want to get tested, you call first and you can make an appointment. That's how they've been doing it in Florida. In Jamaica, they have a toll-free number you can call that if you're symptomatic and you really feel like you're positive or not sure, you can call them and they can arrange some testing for you too, or tell you where to go for the testing. So in Jamaica, they've been doing a really good job at communicating to people about what we need to do now in terms of hand washing and wearing a mask. All right, guys? So remember that even when you're hanging out and so with people, like if people visit you or just hanging out, you know, you're having your own little get together, remember to just wear masks so that way people don't sneeze and cough on each other, and then you don't, and you know, because remember that the droplets are in the air and can be transmitted in the air, and droplets are on the surfaces as well. So that's how they want us to use the bleach, the Lysol, and those disinfectants is for the surfaces. Okay, guys? Remember, do not ingest bleach and disinfectant and Lysol and those things. All right? Seriously. Good. So if you guys have any questions about anything, if you guys need any referrals anywhere, if you're not sure where to go, what to do, but if you feel stuck and you just feel like you just want somebody to talk to, just inbox me, message me, make a comment, or just message me and let me know if there's any way I can help you guys. Cool? Great. So hopefully that talk was helpful to some people out there. Hopefully that will help to stop the misinformation that people have been sharing. Too much false information has been going around, and people think it's a joke, and people think it's funny to be sharing this information sometimes. And then what we keep doing is debating about it and asking each other to send proof, show me what you got, show me what you got. And when they do show stuff, it's old information that has been out there from long time, or it's not relevant to the current time, you know what I'm saying? So you guys just be careful out there with the information that you get and use, all right? And just be safe. And if you guys still need a good primary care doctor and so, I got colleagues who work in Broward County, so if you want to have a good doctor and thing, I have some referrals. And up to yesterday, people were calling me asking for a doctor's office and so. All right, guys? So big up and respect to everybody who's out there working on the front line, all of my fellow physicians, nurses, PAs, nurse practitioner, everybody out there who work in CNAs, everybody. All right. Big respect. Thank you for the compliments, Michelle, about good job, good job. Miss Ebony, big up yourself. Miss Ebony, I was just talking about just vaccines in general and how we've been using them for ages so that people can develop antibodies against these antigens, that are out there, you know, and how they're collecting plasma donation is going on. So please share the video for me, and so we can get more people to donate plasma, especially if they've been positive with corona. So we're looking for positive. We're looking for people who already have the coronavirus, already had it, to donate plasma. The more plasma donations we get is the more people can research about this coronavirus. They can research about the antibodies that are produced by people, and we can learn a lot more about this, okay? So the more so if you want to help, what we can do by helping is share information, share the right information so that we can get people the right help. Remember what they're doing right now, especially down at the University of Miami. They're transfusing plasma into patients who are sick with the corona, who are critically ill, on the ventilator, in the ICU, so that they can build up antibodies themselves. Even though it's somebody else's antibodies, it's still antibodies that are against this specific virus. So I don't know if how people's bodies are going to interact to someone else's plasma, but they're watching them and they're doing the research, and that's the only way we can find out if things are going to work, guys, is that we have to try these things in humans, not animals. But we've tried things in animals first, you know, vaccines get tried out in animals first and different types of models, and then we try them on humans because we want to make sure that people are safe. You know, it's all about safety. Because remember, guys, that us doctors and so, you know, we're not the scientists out there developing these things, but we're at the front line, and we're the ones who have to be using the things that these people develop. And as things go wrong, or if things are not better, or if things need to be improved, hopefully they listen to us. So people been listening, and they've been improving the tests so far, guys. They used to take days before they give us a result, and now they can give us a result the same day, or, you know, a couple hours or the same day. You don't have to wait days for a result anymore. So science is moving fast. The science is moving fast. But when it comes to the vaccine, that will take time, and I hope they take time. That's not going to happen for now. No vaccine's not going to develop for now. That probably won't happen this year, probably not even next year, because they got to take the time, guys, to really research a vaccine if they come up with one, and they got to see how people react to it. And I mentioned earlier about contraindications to the vaccine. We have to make sure that we have to see if it's okay in pregnant people, and it's not any pregnant woman going to show up and get these things, especially now when so much people are talking about it, you know what I mean? So they really need to investigate the vaccine among different population, kids, adults, pregnant women, and the elderly, because the metabolism of each people are different. Okay, so physiologically we react to different things depending on our age as well. Okay, so without going much more into the medicine and the science part of things, I just want you guys to look out, and we'll keep looking out for what's gonna come next. And like I said, you know, a lot of things are experimental now. So even though I mentioned about hydroquinone and quinine, remember we use that for malaria prophylaxis. It doesn't mean that you shouldn't use it, but use it for the right thing. All right? Because those medicines can cause your heart, some side effects on the heart. We call it, you can have arrhythmias, you know, like QT prolongation is what we call it. But either way, it can affect the rhythm in the heart. And when something affects the rhythm of the heart, where it's not beating in sync and beating the way it should beat, then it just goes out of whack. The heart goes out of whack and create all these dysrhythmias, and it can just not pump right. So medicines can cause you harm, guys. So just be careful, okay? Don't try things, especially if you don't know if it works well. All right? So that's been the gist of things, guys. Remember, nobody can force you to take anything. Nobody can force you, shouldn't force you to take medicines, vaccines of any type, or ingest anything you don't want. Nobody should force you to do anything at all. That's just wrong. So it's for the people who are recommending it to you to make sure that you feel safe and make sure. So even as a doctor, I look at the data and I see the research, and I wait till the CDC recommends things, and I wait and see what the data is about. And that's how I've always been. And we have something called vaccine information sheets that the government said that we have to give out to each person as they're getting vaccines. That tells you about the vaccine. It gives you a little spiel about the infection itself and or the bug itself and why the vaccine is important. So we give people these vaccine information sheets because it's no secret, and we want people to be comfortable and know what they just got in their body. So that way they understand that we're preventing some type of illness. All right. So if you need any information at all about vaccines, or if you want to find out what your schedule is like, what vaccines you need, the CDC is a great reference. That is where I usually get my schedule of my vaccines from. And they come in a nice color-coded chart. And you can just look at it online, and you can check up on your boosters. You can see what the indications are, what the contraindications are. But it's something that has a lot of information just on that summary of vaccines, the schedule. Lots of information. So if I'm not sure at all sometimes about age, about contraindications, about who should really get this thing right now, I refer to that a lot. And I double check and look and say, you know what, these are the list of things that you need. And I run through the whole list with my patient, and I tell them what we're protecting them from by giving each of these shots. And if they're okay with it, I go ahead and I give it to them. And I bill their insurance, or I give it to them for free if it's from the government for people under 18, and then we leave it at that. But we're always documenting who we give shots to, where we give it to, whether it's the left, right, the deltoid, the leg, the thighs, wherever you give the vaccine to. All of these things are documented. So if anything goes wrong, let's say you get like something wrong with the arm and we don't know if it's the vaccine, we can double check and think our charts, our medical records, and we can see which part was, if it's the right or left arm you got the shot in. So that's where documentation is very important. I blog about that separately, about documentation and about how it's important to write things down and document what you do to the person and where you give that person the injection, whether it's orally, sub-Q, or intramuscularly. Our electronic record systems allow us to put those information in. So I encourage the physicians' offices out there to get electronic health records if you don't have it electronically, because it helps to keep things in one place, but it helps you to document stuff and have them in one place on the person's chart. So if you have to refer back to the patient and see what they've gotten, if you have to print off the list of vaccines you've given them or you've put into the system, you can print it one place. So I had an electronic medical record called eClinicalWorks, and they're a good company. They have good templates, and so that you can use as family medicine docs and pediatricians and internal medicine docs who give shots. You can use that and document. Seen? One that we usually give commonly to the elderly is a shingles vaccine, is something that we usually give people over 65. So that is one of them that sometimes I double check on to see if it's 65 or 70, because sometimes them change it. So that you will change things. And the Pneumovax is one thing that we give to people over 65 if you haven't gotten it before. And those are shots that we give every 5 years. There are some that we give every 10 years, like the tetanus and the Tdap. So the Tdap you only get once. If you guys never had the Tdap before, that has the pertussis vaccine in it, they advise that you as adults should get the Tdap, not the TD, but the TDAP. The AP part is the pertussis part to prevent you from getting whooping cough, the pertussis, okay? So basically, hopefully that helps, guys. And like I say, if you want to check your needs, see what you need and think, check with your doctor, check with the CDC, the schedule of the vaccines if you're not sure as well, or if you want to read about it some more, you can go on the CDC website. Cool? So if you guys have any questions differently, you can always inbox me, make a comment and let me know if you want me to talk about anything specifically. Anything, it don't have to be related to the coronavirus. You can inbox me, let me know, or make a comment, and we'll just chit chat about something. All right, guys. But respect due for for everybody who logged in. Big up to all my yardies watching. I see you, team. Me see you, red watching from Mobe. Mr. Joseph. I forget what state you're in Joseph, or if it's Canada you're there, England you're there. Okay, you're a world traveler. Big up J Hype. Big up Melford. Awesome. So a lot of us been sharing the same things online, and a lot of us been debating. Cool. Good thing you brought it up. Good thing you brought that up. So J Hype was just saying on my Facebook page, because I'm on Instagram too, guys, just so you know. I've been hearing about this interferon drug by the Cuban drug company, which has been showing some decent results in China. Good. So interferon is a medicine that has been used for a long time now, but we use it a lot in hepatitis and for some other autoimmune diseases. So some of the rheumatologists might use interferon for their autoimmune patients, and autoimmune diseases go back right to square one about what I was just saying. Your own antibodies fighting against your body. So what happens is the interferon helps so that the antibodies and so hopefully won't fight against your own system, and hopefully you can fight off whatever that illness is. Whatever that autoimmune disease is, like lupus and certain things like rheumatoid arthritis, those are autoimmune diseases. Okay, Sjogren's syndrome, I can name a lot. But one thing that I've experienced with my GI doctors, I've referred a lot of patients and taken care of a lot of patients who have already gotten the interferon and who may be a candidate for interferon because they have hepatitis. And I mean hepatitis B or C, not A. But hepatitis is, they have hepatitis A, B, C, E, F. They have many types of hepatitis, and we have some different treatments for it. So anyway, they use interferon as an injection for the hepatitis patients. But guess what it does? It causes hepatitis too. It actually irritates the liver and makes the liver sore and makes it really, really irritated and act up and make the blood work kind of get out of whack. But the patients feel it. They feel sick to their stomach. They don't feel good on it. They turn yellow sometimes because it ends up breaking down and causes jaundice. So what happened is liver disease. So we use interferon to treat hepatitis, which is something that affects the liver. So hepatitis is called hepatitis because hepa refers to liver. Itis means swelling. All right. So the interferon came up as a talk, about a month ago or so. But people have been talking about interferon to treat coronavirus. It is a virus, So I'm not surprised that it came up because interferon is not an antiviral drug. It's not categorized like that based on the pharmaceutical people. But we use it against viruses and autoimmune diseases, like I said. So nothing is wrong with checking it out. Nothing is wrong with trying it to see if it might help, because they've seen it work against other viruses. You understand? So we can try it out and see. That is what we do in medicine. We practice medicine, we try, and then we see how people react. That is a part of the research. So we can't do any type of research until people accept it, and we document it. So that's what they're doing. So it's good that we're trying different things, and they're doing it in China, where there's a lot of people who just recovered and people still getting infected to all over the world. So we just have to wait for the data. It come back down to data. And remember what I said earlier, we have to be careful about data, because people can skew data, people can change up data and change numbers so that something looks good. So interferon is just something out there that people have been talking about for a while, but be careful of that one as well, like I said, because it has a lot of side effects, lots of side effects, and it's in an injectable form as far as I know. Good. And we use it, like I said, guys, for hepatitis treatment and autoimmune diseases. Big up, Andre. I see you just logging on. So yeah, so hopefully that little information gives you guys some insight about antibodies and antigens and about immunity in general, and how we give vaccines to build up your immunity against a specific bug, okay, against a specific antigen, if we're using the right medical terminology. Okay, guys. So if you've gotten confused about antibody and antigens, you can always inbox me or Google it, or I can explain it to you a different way. But remember, antibodies are in our body to fight against diseases, to fight against things. Antigens are outside, they're germs. Antigens are the germs, and they come in and cause problems and make our body have to produce antibodies. All right? And that is how we come up with vaccines. Is they have different ways of making vaccines, where they take the antigen and they put it into a certain formula so that is safe for people. And what they do is kill the virus. And some of these vaccines are live viruses. And some of the live ones are the influenza vaccine, the hepatitis A is live, the HPV is a live vaccine. And as I'm saying HPV, I see one of my gynecologist doctor friends about to log on. Big up to Dr. Theo Nicole Davis. She's a gynecologist, OBGYN in Jamaica. And she's been really watching out for everybody on the internet, on Facebook, and really encouraging everybody to listen and do the social distancing properly, wear masks in Jamaica and so forth. So Tia, I was just talking about it, just basic medicine about antigen antibodies and vaccines, and how vaccines are developed so that we can create antibodies in our own body to fight against it. I was also just telling people about the plasma donations that's going on in the States right now, that they're looking for people who was already positive with the coronavirus to come forward to the blood donation centers or call. They want you to call first because they don't want you to just show up. They want you to, because of the social distancing, to everything we just talked about, they want you to call first and just say, hey, boom, I'm someone who had coronavirus. Where can I come to donate plasma? And you just meet them at the center. They'll open the door for you. They'll bring you inside, take care of you. And when I've given blood in the past, they give me juice, they give me cookies, they give me food, a little food afterwards. Sometimes they give you a free movie ticket, they give you a t-shirt sometime. But I do it from my heart, from long time, just donating blood, you know. But remember, guys, that the more people donate blood, even in Jamaica too, if you want to help people, donate blood, because they can use the blood for one thing and they can use the plasma for other things. We always need blood, we always need plasma, because especially the plasma help people with bleeding disorders, guys, with people who have hemophilus, I'm talking about hemophilus influenza 1 bacteria. Hemophilia, I'm sorry. So hemophilia, heme means blood, you know, hemophilia. So there are a lot of people with hemophilia out there who lack the blood clotting agents that they need to stop bleeding. So they have bleeding disorders that they get because their body don't have those clotting factors that they need from the plasma, okay? So we always can help out people in different ways, not just the coronavirus, by giving blood and plasma, guys, okay? And I've been told that one set of plasma, like one whole blood, can serve a lot of people, you know. But when you need blood, you need blood. If you need a whole pint of blood, that it comes by the pint, you know. If you need a whole pint, then you'll get a whole pint. It just depends on your clinical situation, your medical history, and what's going on, you know, what your needs are. But blood is always important, and we can get the plasma from there. When they spin it down, they can just get out all of that plasma there, and they get the clotting factors, they get the antibodies in there. And these are basic things we learn from medical school, guys, and nursing school, or physiology and anatomy class, you know. So a lot of physical therapists out there, occupational therapists. A lot of you guys went to some type of healthcare school. You might have learned about these a long time ago, our basic medicine, you know, about what blood is made up of and what the benefits are of blood and the different parts of it, okay? And even those people who are phlebotomists who may have learned about that in their phlebotomy class, all right? Because they actually even draw blood. They're even trained to draw blood from certain tubes first. So that way, it's something to do with the clotting too. It's something to do with the way how the blood flows and how it interacts with the things in the tube that we collect. And they've been taught to even collect certain, you know, to do certain vials of first before you do another one. So I learn a lot from my staff, from phlebotomists who come to my office as well and learn and train, you know. So between me training people and they talk and they teach me, you know, to teach one and learn one. You know, it's always good to learn, guys. No matter how much things you think you know, it's always good to learn. It's always good to teach what you know so that we can always help each other. That's how I see it. All right. And as a doctor, medical doctors, in Latin, doctor means teacher. So one of the things that I'm known for is that I reason with people. I allow you to talk and I make you come in and do whatever complaints you have. And then when it's my time to really sit down with you at the end now and really explain what I think is happening, I do take my time. And that's why I miss being in private practice, because I like to do it on my time. And if I don't need to spend time with someone, or they're in a rush, or we don't need to talk long, we don't talk long. But if someone has multiple issues going on, or there's something that really needs to get explained, I take the time. You know, we've had to do lots of things in medicine. We as doctors have to tell people about brand new diagnoses, like even HIV in the office and all these very sensitive things. And we still have to see people in between, and we still have to take care of the psychology of patients when they get these bad news. You know, so my staff has been trained. They were trained to help me out. So if we deliver bad news to people, they can help me by helping them to be there in the room with them and support them. Because people go through a lot. If you feel like you're in class, that's good. That's good. Mike, Michelle, I like that one. You made me laugh with that one. So anyway, yeah, man, that's why I'm throwing the lab coat. So we talk serious business. You know, I have my lab coat on with my shorts on today, you know. So got my jean shorts on and my shirt and thing and my lab coat. So we can teach today, you know. This is my logo here, my hibiscus flowers. That's all from Jamaica. That's my sentimental Jamaican logo right there. And my colors are pink and purple, because I said pink is for the females and purple for the guys. That's how I used to do it. Yeah, pink and purple are my colors. I think pink, purple, and white, you know. But I love my yardy colors too. So that's just how it goes. Anyway, so hopefully that was educational for a lot of you guys out there. Hopefully that will help to make people feel comfortable. You know what I'm saying? It's all because a lot of people are nervous out there. There's a lot of information out there, and people kind of follow. Lots of people following, whether it's on Facebook, Instagram, Twitter, all these things. We following each other, and we see a lot of posts all around. And sometimes we don't know if the information we're getting is correct. So I'm glad that a lot of you guys follow up on the post and say, no man, this one is old, and this one is a long time thing, and you know, this was from 19 no long. So I really appreciate those comments, and really appreciate you guys for showing me stuff too. You know, showing me what's going on, showing me the proof of things, and showing me the news as to what's happening if I missed it too. You know, and that's just how it is. I love social media for that reason. And since a lot of people are at home now, since everybody at home, mostly everybody, we can get to a larger audience now, you know, with social media. So big respect to everybody watching, like I said, worldwide. And, you know, especially to all you guys working out there. I don't care what kind of work you do. Everybody is essential. Everybody is essential. We need people in all corners of the earth to do all types of work. You know what I mean? And all of that, you see slow down now. And you kind of seeing how important it is for healthcare providers to be there at work. So if you never thought about a career or a field to enter, think about medicine. You can do a lot in medicine. You don't have to be a doctor, but you can be a PA, you can be a nurse practitioner, physician assistant, nurse practitioner, nurse, a CNA. But the thing is, we always need good providers. We always need good doctors, nurses, and people who care. So tell your kids out there to think about their career now, that basketball ain't making the money right now, football ain't doing it, swimming and all of these things are professional sports. Even people who are musicians can't go out there to go and perform. The singers can't go and do their tour. You know what I mean? There's a lot of people out there with lots of skill, lots of talent, but they can't work right now. But we can. I always have work to do. Us doctors, nurses, we always have work to do. And one of the things that influenced me to become a doctor is when I was little, I used to see all these things on the news. I used to watch the news when I was little, and I used to see all the starving people in Africa and all over the world with the flies around them, with their belly big from malnourishment and all these things. And I used to wonder why. How come people don't help them? How comes they're like that and we are right here in Jamaica? How come they're like that in all these parts of the world? How come people have so much money out there and they don't help the poor people or people who are suffering? So anyway, so that's why I go into my political blogs when I'm ready and talk about voting and about talking about universal health care, you know, that we need to get everybody access to care. Everybody needs to get to the doctors when they need to, or should be able to get to the doctors when they need to get their help. And like someone said on the live and thing this week, is they should think about doing free testing, which a lot of times the health department does. But like I say, is the government or the health department or the state, same way, has to raise that money to get the test done and to pay people to administer the test. You understand? So it's no problem to talk about the free tests and things. Nothing wrong with that. Speak your mind, free up yourself. We all have freedom of expression and things. Just be respectful. just be respectful, especially to the authorities, you know what I mean? Especially to the people them who looking out for us right now and telling us what to do. But some of them really are just not helpful, some of them. So don't listen to Trump about the Lysol and the bleach and inject it into yourself, okay? Please don't listen to him like that. But I'm respectful of him as a leader to say that he's our president. Trump is our president. And we got to listen to some of the things he says. But listen to the scientists out there, guys. Listen to the people who have the experience in the medical field. And we just, you know, dissect it as we go, just like we've been doing. Let's question things and be safe out there. So big respect to you guys watching on Instagram. Later, they just timed out on Instagram, so just coming off of that. And you guys on Facebook, you have a great day. Hopefully you guys are doing well at home. Dwayne, you're just logging on, just back up on the live and watch from the beginning, all right? I don't know how long it was, but I gotta go right now. I gotta go to bring my son over to his dad, so gotta hit the road right now. So you guys take care, and if you need me to talk about any topics out there, hey, is that Camille? What's up, Caramel? Big up yourself. I was just talking about singers and dancers and how they don't have enough work doing now and going on tour, and then you popped up. She's a singer, but what I love about Camille, she's in the healthcare field too. She's multi-talented and awesome girl. And, you know, a lot of us are, like I said, working in the healthcare field in different parts. You know, whether it's taking care of people or working on the front line as nurses or doctors or working in the background. You know, lots of people working. Big up to Dwayne. Dwayne providing food. Dwayne is a chef and him working and making sure everybody who we need to supply with the food, get the food and thing. So like I said, Dwayne, everybody essential, you know. And Dwayne need help and thing in his kitchen. He needs his staff to work and thing. But we want everybody to be healthy, you know. So I was just talking to Dwayne and Camille, whoever logged on late, about just antibodies and immunity and how it's important to just pass on the message about the plasma donation. We need some more people to donate plasma, especially like how you're up north, Dwayne, and a lot of people in New York are infected. We need a lot of you guys in New York who are infected to please donate plasma. Please just link up with the nearest blood draw center that you have nearby you. Big up to Camille. And you know, let's just encourage our family, our friends, especially the positive people who were positive with the COVID-19. This is where you come in now. You can help others because you survived it. You've gotten over it or getting over it. And we want the plasma so that we can research some more about how this virus reacts or causes our body to react. And it's being used for treatment in the hospital setting, in the critical care setting. And that is one thing I used to do or specializing. I'm a critical care doctor. So I'm somebody who take care of ICU patients. Edgene just logging on, and Edgene, big up yourself. She's in healthcare too. Big up. Love you, darling. Yeah, man. I was just hailing up Dave other day and telling Dave to hail you up still, you know, because I love when a man and thing and work hard. And Dave, her brother, works and does dialysis, and he's out there doing dialysis at home with patients, and he brings it to Jamaica and he helps people in Jamaica with dialysis. So it's funny how a couple people logging on who are into the healthcare field, and I know that they give back in whatever way they can. Dave is a very awesome guy we're always looking out for people in Jamaica, and they've already send down machines and all of these things to help people in Jamaica who have kidney failure, you know, from that and need dialysis. So we'll talk about a lot of these things differently. That is another topic we can do. We can talk about high blood pressure and how that can end up, you know, making you go on dialysis and all these things. But we have a lot that we can talk about. So I just wanted to focus again today, guys, on just antibodies, antigens, the vaccines, and basically for us to just stop spreading the false information and stop ridiculing people, especially if people helping. You know, stop ridiculing people, stop disrespecting people who helping. You know what I mean? You know, everybody have their personal opinion about stuff, but you know, that's just one of those things out there. Yeah, man. But what happening is when people can benefit from vaccines, not the coronavirus particularly, but when people can benefit from vaccines, all it's going to be doing is making people get nervous about it or don't take the vaccine, and then they get more sick or they die from the illness. And we don't want people to pass away from something that they can prevent. So it's all about preventative care, guys. Remember, it's prevention better than cure. We don't have a cure for the coronavirus yet, but hopefully people are working on that, and like I said, with everything we talked about, it will help the scientists out there if we all contribute in whatever way we can. So hopefully that talk helps, guys. And like I said, if you want to hear more about the topic, just go back to the front of the live, like I said, the beginning of the live, and just watch my video from the beginning and just see what I summarized and spoke about today. But I've got to go. Love to you guys. If anything, we'll link up back later. We can talk about something else later on, a different topic. But for now, you take care. Bless up for real. And lots of love from Florida, because a lot of you guys are really going through a lot and really need some love right now. We need to spread the love and not the hate. So keep spreading the love. All right, guys? Keep spreading the love and the positive energy, because things are moving forward in the right way. The curves are actually not spiking like they were. You know, things have been leveling off. It doesn't mean people are not going to keep getting infected, but at least... Hey, large up yourself, sweetheart. You remember me? Aww. Hi, Miss Turner. Hi, Janet. So you took care of me when I was at Sav Hospital. You were one of those who listened to me and helped me out when I was going through my torture and distress there. So one of them days we'll talk more about that. So sorry for the people that in Jamaica and thing, because I don't mind that the Cuban doctors are there helping people, but they don't speak proper English. And I've had some bullies who took care of me in Savlamar Hospital, and they were not good. They ignored me, ignored my the care and stuff there, and they did that to other patients too. And I complained to them at the hospital, and they're still making them work. And that is what I don't like, is that when we know that there are bad doctors and bad nurses out there, that even when I complain to the hospital, that's what happened up here too. When I complained about it here, nobody care. And when I complain about it in South, nobody care. So I just talk my mind, and I just kind of speak out for myself as well, and just tell you guys, be careful. That's all I can do, you know, because the people in the hospitals, they don't care. They don't care. That's why I stopped working in the hospital. There's so much people working in there who don't speak proper English, even up here in Florida. They speak Spanish, Creole, and all these languages, and they don't speak proper English. And I wonder sometimes how they even become nurses. So people might think I'm not for black people and all of these things. And you want to see the comments, people make some time because I'm encouraging people to go get vaccines. It turned into a racial remark or some racial comment. And I'm somebody who love everybody equally, even if you don't like me. Me take good care of you. And I reach out to your family and make sure family knows what's going on. You don't have to call me all day, all night and blow up my phone. I make sure I go to the way to reach out to you. And a lot of times in the past, it's family them don't want to answer, or family not involved, or they're not the one and they don't care. I took care of a lot of people in the ICU, and a lot of them didn't have help, and they died right there in my company and my nurse's company. And we took care of them very well, and we had to wait forever for them to come and claim the body and all these things. When somebody passed away from like asthma attack, for example, or overdose, or whatever the thing is. Yeah. So thank you for sharing, guys. Hi, Tammy. Congrats on your baby the other day. See, I was just talking about vaccines, and you had to get your baby vaccines when the baby was born the other day, Tammy. Didn't you have to get the hepatitis B when the baby born? Because that's the first vaccine that we give babies or give people, is the Hep B. And then usually we do some vitamin K. We do some vitamin for the eyes, so that way the kids don't get problem with the eyes, especially if they deliver in a hospital. So anyway, so I was just touching on a little hospital medicine. So I have a lot of experience with hospital medicine, from between residency training and working in practice. And it used to burn me out a lot. Even if I had one person in hospital, I have to be up I have to be alert 24/7 when that nurse calls me about that one patient in hospital. So I was developing my private practice, and I preferred to stay there in private practice. But I worked a lot in hospital in Florida, and got to know people, got to know the system, got to know medicine in the hospital too. So it's a different type of work. So respect due to all those hospitalists out there who are working, taking care of patients, with all of your supporting staff. Everybody, the cleaning staff, everybody, because you know, say you are the ones who always with me when we're working hard at nights and weekends and so. And we eat together, we vibe together, we joke together and thing in between patients, you know. So big respect to everybody who usually work with me and think, and they know I'm a very serious doctor when it come down to my work. I will smile with you and thing, but you see, if you ever make a mistake, me make sure say it known. And we make sure we correct it and we fix it right now if it's fixable. and we reason about it. But if you have to get in trouble, you'll get in trouble, because I really want people to realize that you do not do harm to people. People in my office have made mistakes, and I tell them, we have to tell the patient you made a mistake. I had a patient get the wrong vaccines. Not wrong vaccine. He shouldn't have gotten a vaccine at all, because he didn't come in there for that reason. And my assistant went to the wrong room and gave somebody who was dumb some vaccines, and he was happy to get the vaccine, but he couldn't tell her anything. So on that note, that is a good one to finish on. This person cannot speak, they're dumb, and I've never met them before, and I go in there to start my visit, and I'm like, what do you mean, Donna, that you just give the vaccine to the patient? She was so feeling bad. She felt bad, oh my God. And that's what meant a lot to me more. You see, because she felt bad and she saw the mistake she made, as she was even willing to pay back for the vaccines. I tell her I could charge her for it, because she wasted vaccines that should have been given to someone else, and someone who had insurance who was actually going to pay for it. And it was not the free vaccines that we give to the people 18 and under. It was my private vaccines that we give to people with insurances who can, or people who have no insurance who can pay for it, or over 18. So mistakes happen, guys. People make mistakes, but it's how you deal with them and how you make your staff learn, or people learn from the mistakes. So learn from the mistakes, and we build from that, and we correct it and make things better. But gotta go for now. You guys really take care of yourself. And Janet, I was glad you were there at SAV with me when I was going through that. That was like 2 years ago. That was 2018 when I was there after heat exhaustion. But that's a long story. We can go into that another time. I ended up back there last year because of the heat again, but it was a different situation. But when I was there in 2018, it was a whole situation where nobody was treating me, and they didn't want me to go home. And that was, they were keeping me against my will, and it was against the law and all these things, and no one could help me and nobody cared. So my family get the complaint about that. Them still hear about it over and over, because them know I don't have closure about that too. So I don't get the backup that I want to get when I'm ready, and I've consulted with lawyers and stuff, and nobody locally can help me. Them say I have to go Kingston for that. So I've been blown off when I complain to the hospital, and when I go to lawyers, and so they say that they can't help, that I need somebody else. So yeah, so I've been there, done that, guys. So when you think you've gone through it where people don't care and take care of you, welcome to my world. So you'll see. So I've done a lot of blogs about that, guys, about my medical conditions, my nerve damage, my spinal cord issues, and how much people misread MRIs, how much people misdiagnosed me and didn't diagnose properly, didn't read the MRI properly at Florida Medical, at Acumen. I see Acumen advertising on TV now. They were previously Signet Diagnostics and then Elite Imaging in Sunrise. Even, University of Miami ignored me too, even though I'm even telling people to help them now and donate plasma. So, so I've gone through a lot of malpractice myself, and I've gone through a lot of that, and my lawyers can't help, and my doctors don't help me in the past, so I've gotten a good team of people now. I've gotten hopefully the right people to take care of me now, who actually listen and very compassionate, but they're very empathetic, and that's all I care about. My new doctor doesn't even have electronic record. He has it, sorry, but he doesn't use it right in front of me, and he double work by doing paper first, and then he have to go in later to do it. So I already see when I requested records the other day that him don't document everything, and they don't ask me the questions that they have on the paper and stuff. So I am over it. I just make sure I'm fine, because I realize these doctors are busy. I've always said that long time to you guys, that doctors are busy, and they don't take time to fill out stuff. They don't take time to even document their notes and so, and that is bad. So that's why I do these blogs, because it affected me, made me lose out on a lot of things, lots of benefits that I had before, because doctors just didn't write things down. That's it. Just that they never write down what they do or what they thought of, or they're not on the same page. That's why when the doctor's not on the same page and not communicating well about the things, whether it's through writing or phoning each other, I can feel the headache coming on. That's just from sitting down. So this is one reason why I don't work anymore, is I get this wicked headache from sitting down. So it's time. My son just came right behind me, because he knows that it's time to leave to bring him over to his dad. So I got a little bit distracted from the talk, but this is what made me happy. I don't have my office anymore, but if I can reach out to people and talk to you about any little topic that's health related, and show you that you're not alone. That when you think you're alone, going through bad doctors, bad nurses, bad caregivers, bad family, bad friends, welcome to the club. I've been through it. I've been through a lot, and I've been pretty much alone for the past few years doing it myself. And my family been supportive in the background. They've been learning, and they've been forgiving, they've been apologetic. I've been forgiving, and I apologize too when I'm ready. So you can forgive others and move on and be at peace. You understand? So hopefully you guys are at peace in your life, and if you're not, work on it, because this is the time now when you're home to meditate on those things. Think about what is important to you and them ways, and just get along. So big respect, guys. Thanks for watching, and big up Janet. Inbox me your number, please, because I lost it. You gave it to me one time before, but my phone was giving trouble last year, the year before, and it didn't give me trouble. Technology. Like how they're bringing up this 5G thing. I'm not surprised if it's something making us sick for true. I totally agree with all those things, because boy, I was just blogging last year. Or the year before, was it last year? Last year about technology and how it's not working out for us. Just like I said with the electronic records. If you don't know how to use the electronic records or the computer, then you're not going to be able to document properly. So it come back down to training and who showing you how to use this right. So you got to take time with your staff, with whoever working with you, and teach them how to use these things correctly so that they can help you and help document things correctly. So anyway, I know we went off on a little tangent about different things, but I just want to show you that I'm only human, and I go through a lot of the same thing you guys go through, all right? And people still ridicule me. Oh, you're a doctor and you follow. Oh, you're brainwashed. Oh, you're a sheep. I got called a sheep today. That's a new one. I love sheep. But we don't have sheep so much in Jamaica, I think, but I've seen them in Wales. I've seen lots of sheep there. But anyway, but fun and joke aside, guys, we're all human, guys, so just be safe out there, wear your mask, and remember to wash hands, okay? Keep washing your hands and keep up on your hygiene. Mwah. So love from the real Dr. G. Big up to everybody, especially me yardie them. Big up to all of me Jamaican them worldwide, all of yardie them that I see, especially you guys logging in and watching, okay? Every day I'm gonna do and talk about something. I don't know what the next topic gonna be, but if you guys have something you want to talk about, let me know, okay? Can be anything. Sex, drugs, rock and roll, medical issues, domestic violence, all of these things. We have a whole lot of things to talk about. Big up to all the radio personalities out there and the talk show hosts and everybody who's been talking about just issues. Big up to Cardi B. I like how she brought Bernie Sanders on there on her Instagram the other day. I didn't know Cardi B followed politics like that, which is awesome, because people stereotype her as somebody who's a dance and all of that and thing, and she cool. Me like how she cool. Me did like her long time from my first meet. Me love her vibes. But me love how she just be herself, and I like how she brought Bernie on there, because Bernie Sanders was somebody who was all about universal healthcare, about healthcare for all. And I hope you guys are realizing how important that is now. So without going further, I think that's a great message to leave us on. Healthcare for all. That's what we need worldwide. Healthcare for all worldwide. We must be able to do this worldwide, just like France, Canada, England, a lot of these places that have universal healthcare, or for their, and it's not communist society and all these things. I'm glad you guys realizing now how much people not getting care, how much people not getting access to care, and how a lot of the doctors and nurses don't care either. And how, especially on the ventilator and all these things that you might need, how it's a big decision sometimes, whether to put someone on the vent, whether to withdraw their care from the vent. It's a lot, man. It's a lot that we go through as physicians and caregivers and stuff in the hospital and thing. So thanks for your patience, guys, and sorry about, my condolences to all those loved ones out there who had somebody, who had loved ones pass away, or friends, family passing away. I had a nurse friend who passed away from coronavirus too. Earl, big up to Earl Bailey. May he rest in peace. So I did a little blog about Earl the other day and thing about how he may have had underlying conditions differently from coronavirus, and that maybe even that has contributed to his passing away. So remember, guys, remember to get your physical done whenever you can. Remember, prevention is better than cure. And remember to donate plasma whenever you can. I should do that too. I'm gonna call like tomorrow, like Monday. When Monday come next week, call and see where. I've never been positive with coronavirus, but I donate blood on a frequent basis, and I haven't done that in a while. I haven't done that in over a year now, so I try to keep up with that and give a unit when I can, when I see the van and stuff like that. But like I said, guys, I haven't been tested at all for coronavirus, so I don't know if I'm positive or not. So I wonder if they even test you for that before you give blood to just confirm, you know. I'm just curious still. You know, you wonder how they know who is positive before they give the blood. They probably have a rapid test that they do to just confirm it, you know. So those are little things that I'd find out as we go along. So you guys, you have a great evening. Like I said, thanks a lot for hanging in there with me. Thanks for listening. And for those who want to listen, like I said, big up and respect. We'll come back on tomorrow with another topic and we'll continue talking about medicine, okay? That's my passion still, is medicine. So big respect, guys, and big up to the American Family Physician and all of you primary care guys out there and pediatricians out there. Big respect, and let's continue promoting vaccines as, you know, as our way to prevent illnesses. And let's wait and see what's going to happen with the COVID-19 and what's going to come out. All right, guys. So big respect. Little more, and big up to all the scientists out there working hard and things, because you guys are working fast to try and get us help as fast as possible. So keep the work going, and especially to all of those who donate towards research or donate to any cause. Lots of donations been going on towards homeless, towards the poor, towards people who are not just working and need food. So remember, there are food drives going on. I've been sharing flyers about that. We have flyers about food drive even tomorrow in Broward County. So keep looking out for those things. And if you need food, you can go on the website at the Broward County Food Bank. You know, you can check out the food bank in Broward County, and they have pantries that you can go to get food if you really need to get food. Okay? So big respect, guys. Again, from the real Dr. G with love, because we're not bringing it fake. This is the real Dr. G, because I just like to bring it real and just be myself. All right? So big respect from Dr. Gaynair with love. Mwah. And happy anniversary to Gainstead High School, 79 years, 79th anniversary of my granduncle's school, granduncle George and grandauntie Freddie. So Freddie and Uncle George, may you rest in peace. You guys taught me a lot, and you taught a lot of kids out there who are now adults, and people tell me all the time how they used to go Gainstead and how they, even if they used to get caned, or even if they didn't like Uncle George, they like talking about Gainstead and back in the days, you know. So I've met a couple people like that on Facebook. So big respect to all the Gainstead family, past students and present students, because that's my family right there, Gaynair from Gainstead, okay? And that's right by the stadium in Kingston, guys, by National Stadium, round them ends. Gainstead High School is there. If you've never been there before, you can check it out, all right? So big respect, guys. So we're a family of teachers. So respect due every time. See, little more from Dr. G.